So we're excited to be launching Acuvue Oasys with Transition. That is the lens the first of its kind. It seamlessly adapts to changing light. Basically, the lens knows light that is able to help you reducing the stress that you may have of changing light conditions and giving you the perfect visual experience.
It's the first of its kind. There is no lens like it. It's made on the best material we have today, which is silicon A. And the range of the SKUs and the base curve is very similar. It's the same than the current silicon A clears.
So this is an extremely new product. We just started rolling that out in the US. What is amazing that the UK is actually the first country outside the US that is starting having the product.
We spent 10 plus years on the product. Every single clinical study we have done, we have very, very positive response from the patient.
When we think about the opportunity with this product, it's actually driving more interest in contact lenses, reaching out to different audiences that maybe have not been trying contact lenses so far, and put a little bit more spice, if you want, into the contact lens market.
The light bulb moment was the insight from the patient. It's when we did the survey on 1,000 patients and we asked them, are you bothered by light? Are you sensitive to light? 64% of the patients said that they are bothered by light.
I'm one of the scientists who've done some of the many clinical studies on the photochromic contact lens. And what we did is we designed a study where we would put the photochromic contact lens in one eye and then just measure the visual functions in across the two eyes. So for example, one test was called the photostress recovery test. So we exposed them to a really bright, glaring sunlight source and then measured how long it would take them to recover. Another one was glare disability. Another one was squint. So we used very high resolution video photography to measure their eye in the natural state and then photostress it and measure the amount of squint by the height of their palpable fissure. And in all these tests, we basically found that the photochromic contact outperformed the clear contact in a variety of conditions. So what the surprising thing though is that we also, obviously people wear these lenses when they're indoors too. And so we were interested, well, how would these lenses affect their vision indoors? And the surprising thing was that it improved their vision indoors too. One thing that sensory psychologists look at is how physical changes in stimuli relate to perceptual or sensory changes. And the most nonlinear function is brightness. So people historically weren't in situations where light changed as much as it does. They were either outdoors, right, or sort of indoors at night and it was just dark. So there wasn't devices and blue LEDs and headlights. And so essentially, humans didn't evolve to deal with modern variations in lighting. We evolved to deal with natural variations in lighting, which was much different. This is one reason why people have issues with migraines and insomnia and light-based issues. So there's a whole new area of science called photobiology that deals with how light affects human health, visual function, visual comfort, all these things. So I think that the real innovation with this technology is that it's aiding that transition. It's allowing us to deal with modern life.
What we hope this lens is going to enable is a good discussion, a serious discussion between the doctor and the patient about light. As a doctor, we owe the patient the best visual experience, and that should be part of, I'm correcting vision, but I'm also providing a very sustained and very robust solution for the patient, which is something that adapts to the changing light.
A lot of this has started off, with a lot of innovation and a lot of development. It starts off with problems that consumers face. One big problem has been accidents due to bright light or how people are bothered by bright light during their day. When asked these questions, the overwhelming majority of patients will complain of bright light, squinting and even in normal circumstances. Dealing with variations in light is a real challenge. And so this specific lens is developed to meet that specific challenge. It's one of the major complaints, and it's designed to satisfy that complaint. And our data show that it does.
It's a very exciting feeling very, very exciting to see the product come into fruition after 10 plus years of product development. We are very confident that it's going to delight our customers. It's the latest technology, it's breakthrough, it's the only lens again. So we'll see how it does, but we have no doubt that it's going to be fantastic.